Christine Leehealey, and I'm a board-certified rheumatologist. I have treated patients with arthritis and autoimmune disease for over a decade, and some of the most common questions I get on a daily basis are, what foods should I eat to help my condition? What kind of diet is recommended to help with my joint pain? While there are no major clinical trials that have addressed this, I have begun to research these questions which are so important to my patients. Based on the medical literature we have available, I really believe in the power of food choices. And not only have I developed recommendations, but I've also incorporated these into delicious recipes to share with you. In my first cooking segment, I'm going to show you ways you can incorporate omega-3 into your diet. Why omega-3? Here's the chemical structure of eicosapentaenoic acid, or EPA, a product of omega-3 when it's broken down in the body by enzymes. EPA eventually breaks down further into hormones called cytokines that decrease the body's inflammatory response to injuries. As a rheumatologist, I see patients with systemic lupus and rheumatoid arthritis, or autoimmune diseases where the body's immune system is attacking itself. I also see patients with other types of arthritis, such as osteoarthritis. The basis of these diseases stems from different sources of inflammation in the body. There's a lot of medical literature on how omega-3 can help decrease inflammation, not only with arthritis and joint disease, but also in many other organ systems. Cardiovascular studies show that omega-3 can decrease cholesterol and triglycerides, as well as decrease risk of heart attacks. Neurologic studies show that it can decrease risk of dementia and stroke. Gastrointestinal studies show it can decrease inflammation in the gut. Oncology studies show that taking omega-3 can decrease risk of certain cancers. There are even studies showing decreased risk of depression in patients taking omega-3. Both the American Heart Association and American Psychiatry Association, among others around the world, recommend 1 to 3 grams of omega-3 per day for their patients. It really has wide-ranging benefits. But back to joint disease. I have many patients who have reduced pain, improved function and activity when they take omega-3 supplements. Some patients have even been able to decrease their pain medication, something which has been shown in clinical trials too. When my patients ask, what can I eat that can help my arthritis, they can start by cooking omega-3 rich foods. Come into my kitchen, I'll show you how. Today I'm making a family favorite, teriyaki salmon with edamame salad. Now salmon is a really great source of omega-3, and each of these 6-ounce fillets contains about 3 grams of omega-3. You can use store-bought teriyaki sauce, or you can make your own teriyaki sauce, and I'm going to show you how I make mine. So in my saucepan I have a ½ cup of soy sauce, and I'm going to squeeze the juice of 1 orange. If you don't have fresh oranges, you can always substitute with a ¼ cup of orange juice. Okay, so that was the second half of my orange. I'm going to also combine 2 tablespoons of brown sugar, 1 tablespoon of ground fresh ginger, and 2 tablespoons of rice wine vinegar to the mix. Now if you don't have the fresh ginger, you can always go and use some of your ground dry ginger, about 1 tablespoon as well. So I'm going to combine this sauce, and I'm going to actually put it on the stove and simmer on medium heat. So once it starts simmering, you want to continue to stir it the whole time, and it will reduce the volume by about 50% when you simmer it for about 5 minutes. Okay? So here is my finished thickened teriyaki sauce. It is great for not only salmon, but I use it to marinate chicken as well, and even beef. So I've preheated my oven to 400 degrees. I've placed my salmon fillets on a lined baking sheet, and I'm going to sprinkle some salt. And then basically just coat the tops of the salmon with my teriyaki sauce. It's really nice and spreadable, and it does have a little bit of pulp from the orange and the ginger, but that's perfectly fine. If you don't like the pulp, you can certainly strain it out before you cook the sauce. Okay, so I'm going to put the salmon in the oven for about 15 minutes, and it's as easy as that. My edamame salad, I'm using shelled frozen edamame beans, which you can find in any grocery store freezer nowadays. Usually you see edamame beans in the shell at Japanese restaurants as an appetizer. Edamame is basically an immature soybean that's been picked before it's hardened. They're soft, they have a mellow taste, and they're usually eaten steamed and lightly salted. They contain a lot of protein, but also a lot of omega-3 as well. I'm making a simple edamame salad with carrots and corn. It's sort of like a succotash, but the edamame is a lot better tasting than lima beans. I have a few ingredients to add, so I've cut the kernels off of 2 ears of steamed fresh corn. Okay, and basically I just cut it right straight off the cob, like this. Okay, to this I'm going to add 1 cup of diced fresh baby carrots, which I've also steamed. To this I'm going to add some salt and some freshly ground pepper. And then I'm going to add a drizzle of extra virgin olive oil. Now, I've tried many kinds of succotash. Some people make it with vinegar or balsamic or butter, or even add ham or bacon. You can add whatever you want, but I really like mine simple, with some delicious avocado on top. Now, actually, avocado is a great source of omega-3 as well. So I have scored inside the rind, and I'm going to basically scoop out the avocado so it keeps its dice. There we go. So I'm just going to mix this all together. Beautiful. Very, very colorful. Now let's check on my salmon. Okay, so I'm done cooking. I'm plating up my edamame salad next to my teriyaki salmon. It's colorful, and my family is going to love this. This meal has about 4 grams of omega-3 and is really, really tasty. I'm Dr. Christine Leehealey, and these are cooking points for healthy joints.